TX004HR is a new novel estradiol soft gel capsule, which is in clinical development now by a company called Therapeutics MD, and they're in Boca Raton, Florida. And the product's being looked at for the treatment of painful sex or dyspareunia associated with postmenopausal vulvovaginal atrophy. There are current treatment options. There are systemic estrogen products. There are some local products. There's creams, there's gels, there's rings associated with estradiol, and there's a vaginal tablet. The issue with many of the products is the acceptability of the products. So there are over 70 million women, postmenopausal women, with vulvovaginal atrophy. And of that, it's estimated that about half of them have symptoms, and only a small portion of those, maybe 2 million women, are being treated. So there's about 30 million women with this condition who are not being treated. So this was a pivotal study, phase 3 clinical trial, randomized clinical trial, looking at 3 doses of TX004HR versus placebo, 4 micrograms, 10 micrograms, and 25 micrograms, and as I said, placebo. And the endpoints were looking at both objective measures for vulvovaginal atrophy and subjective measure. So in order for women to get into the trial, they had to have evidence of dyspareunia, which they said was their most bothersome symptom associated with their vulvovaginal atrophy. So the results showed very statistically significant improvements in the objective measures, superficial cells, parabasal cells, and pH. All of these things are found to be either increased or decreased with vulvovaginal atrophy, and improvement in the most bothersome symptom of the dyspareunia. In addition to the dyspareunia, vaginal dryness was also greatly improved in the trial too. The dosing of the product is quite low, and in an additional study that was also presented here at the Endocrine Society, we showed that there was very low to negligible systemic absorption. So we got great efficacy on objective and subjective measures with very low to negligible systemic absorption. It gives women an additional option. There's clearly a large number of women who are untreated. It's a huge population. It's a progressive condition without treatment, and it gives women an option that they may find to be more desirable or more easy to use, that is clearly effective with very low dose systemic blood levels of estradiol. The number one adverse event that was greater in the treated group than in the other group was headache, but it was still small within what you would see in a normal clinical trial. I think that the condition it's an important condition. It's an undertreated condition. It is, as I said, only about 2 million out of 30 million women who really have symptoms are treated. It provides an option for women. And it was absolutely efficacious, and it was safe as well.